And we have the WHO here, whose sole responsibility is also to globally monitor what is happening in terms of Ebola. And also just hiding that is grossly unethical and irresponsible. And as a ministry, we have no desire to do that at all, and it will not help us. So what is important is for us to give out the correct information. The case that really caused a lot of anxiety and alarm was the one that happened, and we took the patient to Wilkins, and we shut down Wilkins and managed the patient. What really was happening is not that there was Ebola, but we put systems in place. We wanted to find out how robust these systems are. And you can only find out by doing a trial run, a test run of the system, and to see where the gaps are, to see how it is doing. Should we eventually get an Ebola case, how do people react even after you've trained them? How does the movement actually happen? So we were waiting for an opportunity to test that system, and we got an opportunity when the student from the poly came from Lubumbashi. Although Lubumbashi is about 3,000 kilometers away to where the Ebola cases in the DRC are. But we thought it was a perfect opportunity. She had a high temperature, she had anemia, it means she had lost some blood somewhere. So we said, look, this could be Ebola, let's treat it like Ebola. And go through the whole monte and just see how the system works, including to movement from Pare, how the staff reacts at Pare, how the movement to Wilkins Hospital is going to be, how we treat it when it is in Wilkins Hospital, how we evacuate everything and shut down the place and leave it isolated. That's what we did. But we couldn't say, okay, now don't worry, we are doing a trial run. It will not work. But that's precisely, the patient was tested at Parenato Hospital and confirmed to be a malaria case. But we started them on treatment, but we said, okay, this is a potential Ebola case. So let's see how the system works. So we've got a robust system, but naturally we want to keep fine-tuning it, improving on it, so that if should eventually the unexpected, the very unlikely event that we get an Ebola case here, we'll have a very well-oiled system to manage this. The training of healthcare workers, of every stakeholder, is an ongoing process, including training of people that are in the burial, in the funeral parlors, and the people in burial in burial societies at home, at rural areas, so that everyone who's going to come in contact with a body, with a live person who has Ebola, is adequately prepared to deal with it in terms of the infection barrier mechanisms, infection control mechanisms. And we believe that's our first line of defense that we really are working on very hard. But after that barrier has been broken and a case has gone through, what we need now is management of the cases. And we're also training people on how to manage Ebola cases and how to treat them, what to do, and all those things. So as government, we know the chances are very unlikely, but that being the case, we are not taking any chances, because even those unlikely chances can happen, and we believe it is important for us to thoroughly prepare ourselves for any eventuality, and that's what we're doing. We've also now prepared and sourcing resources for adverts on television, adverts on radio, adverts in the newspapers, online, just telling people on the information. Yes, we've have so much IEC material that we're distributing through our various channels. We We have the community health workers, sisters. We have village health workers. We have the system of AIDS committees, national AIDS committees, provincial AIDS committees, district AIDS committees, that we had used during the AIDS campaign. But we believe that we can still use the same structures to disseminate information up to the village level. So, but we're going to be on each and every platform. And we're quite grateful that the view that this disease is not about the Ministry of Health, but about every Zimbabwean is well understood. And also, you as people who peddle information, who give information, I'm glad that we're interacting so that we get the right views. If someone is asking you on an individual capacity to forward this to as many of your friends as possible, that there's Ebola somewhere, I think immediately deal with that, even phoning them and say, please stop this, because it doesn't help anyone. In fact, what people don't realize, we already suffer without having Ebola by just association. One, that Ebola is in Africa. In some people, Africa is one big country. So if it's in West Africa, it means everyone in Africa is potentially Ebola. Or whether you are there or you are in Southern Africa, it makes no difference to some people. So business meetings have been cancelled. Seminars have been transferred out of Africa. Tourist visits have been cancelled just because of that. So imagine if we actually have Ebola here. It will be a disaster for the country and for everyone.